All right, so now we're going to doff or remove our PPE. So it's going to be in the opposite order. Gloves come off first. So if you see, she's pinching on one glove, turning that glove inside out. Now she's going to use that glove to pinch the other glove, turn it inside out, and they go in the trash. Then we're going to hand hygiene right after removing our gloves, right? Because we don't want to put our hands up near our face or anything until we've hand hygiene. All right. Next is going to be the goggles. So the goggles, she's going to push behind her ear and push them forward because that part is clean. And she's going to grab and pull them off. Those will go in an area on your tray or in your wherever where it's going to be processed. So those will go to sterilization to get processed. Next is going to be her mask. So her mask, she's going to grab the loop behind her ear, pull off her mask, and that goes straight into the trash. So masks are per patient, okay? Next is the gown. So this is where we don't want to tie in the front, because if we tied in the front, that's where all the patient stuff is. So we want to untie the back. She's going to untie. We don't want to touch the front of the gown because that's where we were sitting with the patient and that's going to be contaminated. So she unties. And if you can't untie and you're not going to use it anymore, you can just rip it. Perfect. Now, if you watch, she's staying on the outside of the gown. She's going to take one hand and go inside and turn that gown inside out. So she's not touching the outside of the gown. Perfect. The other hand goes inside. The gown is now inside out. She's going to roll it up and it's going to go in the trash. So remember, gowns can be used until they're visibly soiled or end of the day. So if you need to hang it up, you can. Perfect.